And now I want to share with you a very important element here known as how to use AI. So let me share with you what is called an AI. As a computer engineer by training, we collect data. After I collect enough data, I process the data, it becomes information. After I process the information, it becomes knowledge. After I process the knowledge, it becomes intelligence. So there's human intelligence and there's artificial intelligence. So what is artificial intelligence? Is where I use something called ChatGPT. So now I give a case. How many of you do a survey? How many of you here, before you see a TCM practitioners, you do your homework, go Google? Many of you are doing that nowadays, correct? So if you are doing that nowadays, now teach you all. You are my participant. I'm very open with my students. Before you see any practitioner, you do this check. Tell the ChatGPT your condition. For example, this is a condition that I come across a couple of months ago. There's no name here, so no issue. So I have a patient with diagnosed with bowel palsy. What's a bowel palsy? The face numb. He's happened to be diabetic, high blood pressures. And seeking treatment for bowel palsy with the right face numb, not able to close his eyes and mouth. And these are the pulse. And for those who are keen to learn more, you can join a fundamental class. And once I put this query, we call it query, questions. I ask appropriate question to the ChatGPT. So it run. So what happened now? You produce a analysis for me. So this patient was diagnosed with bowel palsy, suffering diabetic, currently seeking treatment for bowel palsy, and the pulse was very slippery pulse, red tongue. Analysis, bowel palsy, wind invasion, facial, yang meridians, weary pulse. Okay, now treatment-wise, what should I be doing? Acupoint, diet, medicines, all this will be presented. So what I want to highlight to you now is you are learning, acquiring knowledge of asking correct questions. A TCM practitioner going forward will have to acknowledge or basically assess that whether this point is appropriate for you based on the diagnosis in the clinic. And for example, point was given. Should I use all the point or use some of the points? And that will be knowledge. The intelligence of the practitioner and the intelligence of the patients. So what I want to highlight to you nowadays, the reason I share with all of you this is because this is a trend. There's no way you can stop the trend from going forward. So since that being the case, let's embrace it. Learn about it and see how it can help you. So this is called a simple case, called a complicated case actually. A bowel palsy is a complicated case. But it can be addressed from a Chinese medicine perspective. So just to share with you about the latest trend, and you can help yourself by learning all these things. And there's nothing wrong about AI. AI is just a tool. So I have nothing to hide as well. I use AI because it enhances my presentation, it enhances my clarity in treatments. Okay, any questions?